Welcome. Thank you everyone for signing on today. We hope you're enjoying the Reboot Work Festival. My name is Diego Lamonto and I'm the VP of Product Marketing at UiPath. Today I have the pleasure of hosting this panel. It is robots we can relate to in the time of COVID-19. I'm joined by Steve Gordon, the Director of the California Department of Motor Vehicles, the DMV. We're also joined by the team from the Cleveland Clinic representing nearly 70,000 caregivers in one of the largest health systems in the world. Thank you for joining Charlie and Bob from the Cleveland Clinic. The global pandemic has pushed government agencies, businesses, and healthcare providers to innovate like never before. I want to turn first to Steve Gordon. Steve, thank you for being here. Please, to start, why don't you tell us a little bit about your role leading the California DMV and what challenges the pandemic has forced you to deal with?
Hi, Diego. Thanks for having me today. So I'm running the California Department of Motor Vehicles. We're 10,000 employees strong. We have about 180 offices all across the state. So we're a very large retail footprint of the state. So challenges that we're seeing are very similar to what we're seeing any other retailer would see. We are everywhere and we're dealing with customers in all facets of life and work and so on. So we're dealing with, engaging with the public as well, because we're a public agency, administrative agency. We take drive tests with people. So we're very close to customers and we're very close across the counter, we're very close with them in their cars and so on. So it's a huge challenge, being the retail presence of government here in California.
So what are some of the challenges the pandemic has forced you to deal with?
Well, a couple. One is drive tests. We do these vehicle test drives. We help people get certified to drive, and you can't be 6 feet apart in most of these vehicles. So we've had to deal with, the social distancing aspect, PPE, and others to have, we had to adapt some of our services. In other cases, we have people that we wanted to actually work remotely, and the state really didn't have a strategy for doing that. So we've had to digitize a number of documents and distribute those so customers and our customers could be served, but our employees could work remotely by using their home workstations and computers that we provide, so they can actually provide some of the data entry and some of the administrative and review tasks that they would normally need to do on paper in the office. So those are just a couple, but again, we're a retail presence, a retail footprint of the state. So you can imagine everything a retailer, a grocery store, a retail food store would have, we have them because we see tens of thousands of customers every day, even during COVID-19.
Yeah, it's amazing how every business that we've talked to, and I've talked to a lot of businesses that had to adjust to the pandemic, the stories just vary, right? Every business is different. Every situation is unique, and everyone had to deal with it in their own special way. So it's interesting to hear some of the challenges that drivers and the DMV themselves have faced over this time. So let's go back before the pandemic, a little bit about automation in general. What were you looking to accomplish by bringing automation into the DMV? What goals did you have, and sort of what were you looking to do?
Yeah, a couple things. I mean, one was we wanted to streamline some of the administrative processes we have. We deal with thousands of papers every day, millions of papers. If you think about it, tons of paper is handed across the state. So one part of that was to digitize that paper as best we can. So we don't have to drive trucks across the state to move, as a green state, we don't want to be driving paper across the state to recycle it in another location. So we wanted to digitize it. We wanted to use machine vision, machine learning, then OCR to get it in a digital form. Then we could use automation to do some of the data entry work where it was very clear what to do. One specific use case we have is the digitization of many of the items for Real ID, which has very specific requirements handed down by the Department of Homeland Security. And so our job is to make sure that those documents are recognized, a passport, a birth certificate, a residential document, a bill, an invoice you might get from your utility company. We have to recognize those, pull some data from that, get that into our system. And so that's a combination of digitization strategies, automation strategies to make that real so we can be more efficient and effective to serve our clientele.
Makes a lot of sense. Yeah, I guess, the goal is to get people out of the offices, right? Out of line, on with their lives instead of dealing with paperwork. And it's wonderful to see that automation's helping you do that. So, that's what you're that's some of the processes that it sounds like automation is helping with. But why is it such an imperative at the DMV? Why should government and business leaders, but I love hearing about why government leaders should care about automation now.
Well, I think there's a couple of reasons. I mean, one, we need to be efficient and effective for our customers. The last thing somebody wants to do as a customer, putting on my taxpayer customer hat, is to sit in an office across the counter from somebody while they're essentially doing data entry. So we can have RPA do data entry. We can use some of the digitization strategies that are in the market to help us digitize and prepare that data for entry. That streamlines the amount of time you need to actually be in the office. So the first thing is to reduce that cycle time and only apply our scarce resources to the things that are cognitively important, things they need to think about, the nuance, the complex. That's good for our employees as well, because that gives them another career path. It moves them up the economic food chain, creates new opportunities for them to learn new skills and grow with the economy, and not essentially be a typist for a customer for data entry. So that's the number one thing we're trying to do. But the bigger issue is for our customers. There are 40 million Californians. And the last thing I want any of those folks to do is to unnecessarily stand in our office while we're heads down, keying something into our system. We want to have a relationship with them. We want to be able to engage with them across the table and again, help them solve their issues efficiently and effectively. And that's not by heads down typing in some data they put on a piece of paper, because that's how we did it 50 years ago.
I love that perspective. When we talk to businesses, they're coming at it of the mindset of I want to make my employees more productive. I want to free people from paperwork so they can do their jobs more effectively. But you guys are thinking about how do you make society function better, right? Get people not necessarily more productive from a work perspective, but getting them to their lives better, right? And letting them get and enjoy their time and really contribute to society by freeing them from some of this mundane stuff. So really, really interesting, Steve. That's incredible story of the success and the technology and how you're really using it to rise to these immense challenges we're all facing in society. We're going to turn now the discussion to the Cleveland Clinic. We're joined by Charlie Sweeney and Bob Gross. Charlie is Cleveland Clinic's Director of Automation Solutions, while Bob leads the Revenue Cycle Management Transformation Initiatives. Both Bob and Charlie recognized an opportunity to pivot their automation program to address the challenges to the healthcare system from COVID-19. So let's get into it.
Okay, let's start, Charlie. First question's for you. Can you tell us a little bit more about automation at the Cleveland Clinic and some of the challenges that were presented by COVID-19?
Yeah, definitely. So I started in July of 2019, and Bob had two individuals tapped to be who are now our core developers, who had already been going through Revenue Cycle and doing Gembas across the entire board with Revenue Cycle. And out of that about 100 use case review, we identified two really high value targets that we wanted to do a proof of concept with. So for the rest of 2019, after I got there, we did a really successful proof of concept to build a claim status handling bot and a insurance verification bot. Once we really established those two bots, we knew that RPA was going to be a really big win for RCM at the Cleveland Clinic. So that rolled us into 2020, and we hired another developer at the beginning of 2020, and we have added two more since. But at the time that COVID hit in about end of February into March of last year, we definitely were given some quick initiatives to help support the Cleveland Clinic response. And our first initiative that we had been asked about was to almost, for lack of a better term, dummy-proof the ability to register and check in our COVID drive-through patients. Our initiative was given to us to say, make sure that this is absolutely efficient, absolutely correct, and anybody can take a seat and do this work. At the time, we were not sure how we were going to handle the caregivers and where they were going to work or what they were going to do. But if we could build a bot that anybody could sit in the chair and manage that bot and check in patients, that was the goal. So we were really successful, and I have to give all the credit to our developers. They spent the entire week, they probably put in 60 or 70 hours that week without even complaining once. And they built an entire bot. And actually, at the time, we had no production environment. We were just in the midst of creating a new production environment. So not only did they have to build an automation, but they had to stand up a new production environment, build the automation, and they got it done in a week. And it supports our caregivers that are processing all those patients going through. So for that COVID one, that was a really big win for us. We've also really focused on the speed of how quickly we can get data to our departments of health and how quickly we can get data from our departments of health. So another two automations that we built were to help support processing and sending all of our COVID positives and COVID probable patients to the Department of Health. And that one actually really supported nurses. The team that was doing this was nursing and caregivers that could be spending their time doing a lot more effective work right with patients. So we were able to take all that away from them and give them the time back to process and work with their patients.
Just real quick follow up on that. How did that communication happen? You know, if they're on the front line and realizing that there are inefficiencies, you know, how do you so quickly get it to developers to, you know, build an automation? What I think there's often a breakdown in between different parts of an organization to get that kind of speed, but it seems like that wasn't a problem here. How did you enable that rapid response between the teams?
It was an absolute incredible response from everybody in the entire finance department. I couldn't believe when I sat back on that Friday, I said, you know, every barrier and every wall that you normally have to deal with, everyone jumped and helped us. So all the way up from leadership, our executive director, Tony Helton, all the way down. And Bob is the man in revenue cycle. If Bob says go, everybody goes. So really that helped create the atmosphere that this was a collaborative effort and everyone was involved. Everyone approved what we were doing. If there was anywhere that there was pushback, there was always somebody quickly responding to them and saying, no, we need this done right now. And it really was a team effort. It was incredible.
Wonderful to see groups like you rising to the challenge, and you clearly did. So Bob, next question is for you. So given all that, how did you pivot the automation program to address these new challenges? We talked about in the moment, but you know, obviously it's been quite some time from there, and I'm sure you've seen some transformation. So how did you do that? How did you manage that pivot?
So the first big change that we had to make to the way that we were approaching automation is to recognize that our response to COVID was of the utmost priority. So as Charlie mentioned, you know, how did we get cross-functional teams to rally around in automation so quickly? We all knew the implications of COVID, and we all knew the implications of not responding in a timely manner. So traditional measures like return on investment, you know, took a back seat in the case of our COVID response. And we really focused instead on, you know, number one, creating a safe environment for our caregivers and our patients. Anything that we could do to improve the safety or improve the outcomes of what we're all still learning at the time was, you know, managing a pandemic was critical. So when we talk about the drive-through registration automation, the entire business case, if I could even say there was one, was simply to make sure that we didn't make any mistakes in labeling test results, in that we never allowed a backup of cars in the drive-through lanes because we were trying to register patients. And that was critical. You know, when we look at the work that we've also done on other COVID-related initiatives, the reporting of positive and probable cases to the Ohio Department of Health, filing for additional reimbursement from the federal government due to COVID-related expenditures. Those are all pretty easy to prioritize in the face of a pandemic. I think it's important that organizations realize, even outside of a pandemic, the lesson that we learned as part of this implementation was that you do need to value other measures besides hard return on investment. There is always the opportunity to improve quality outcomes, whether you're a healthcare provider or in any other industry, as well as improving the lives and the experience of your workforce. When we look at specifically the reporting to the Ohio Department of Health, the team that we had performing that reporting were all clinicians and nurses by trade. They're much more valuable in their capacity serving as infection preventionists. So actually following up on contact tracing, following up on identifying the root cause of infection spread. It is not the best use of their time to be manually entering data into a website. So, you know, they were burning out. By the time we got to help them, you know, they were burning out. They were having a hard time covering all the shifts. So, you know, improving the the quality of life during the workday and really focusing our caregivers on what they're best at and operating at the top of their license is another key success factor.
That's great, Rob. What was the automation that you provided for the drive-through screening? Can you just give us a quick description of what that was? Because I think it's a fascinating use case.
Sure. Yeah, I think the other thing that COVID did for us is it really challenged us to think outside of the box with the way that we were leveraging UiPath and automation capabilities in general. The COVID drive-through registration bot is an attended automation. It was our first attended automation. I certainly know it wasn't UiPath's first, but essentially what we saw was that we could not take this process and move it to an unattended environment because it needed to occur in near real time. We also needed a human caregiver to be spot checking the bot as it was performing steps to complete the quality assurance step. And we needed to minimize the turnaround time. So as soon as the registration was complete, we needed to let the drive-through lane know that that car could pull forward and proceed with their test. So the entire automation is an attended automation. It's triggered automatically by our caregiver entering the correct screen inside of Epic, which is our electronic medical record system. They do have the option to either check the patient in by themselves the normal way or use the bot as their attended assistant. When the bot is selected to run, it takes about 30 to 45 seconds to complete the process. Normally, if a person was doing it, it would take upwards of a minute and a half. But that's really moving fast. And that was our biggest concern, was that we could not afford to make mistakes in the process. So that was our first attended automation. I think the really cool part was that it demonstrated for us the power of an attended automation. We were really struggling before that to understand, like, hey, what's a good use case? What do we really need to be doing in real time? And it presented the perfect opportunity for that.
What an amazing example, inspiring, actually. Okay, so Charlie, back to you just to wrap up. So, what are some of the outcomes then you've gotten from these automations, this automation program? We hear the rallying around. Sometimes, in the crisis, we threw out some of the restrictions on getting things done, but ultimately you're going to measure it, right? And I'm sure you've been able to determine what some of the outcomes are. If you could share those with us, it'd be great.
Yeah, well, and first and foremost, efficiency gains. So that one's pretty obvious. We have created the capacity for our caregivers to focus on much more cognitive work that we really rely on them and their expertise to answer those questions. So to kind of piggyback off of what Bob was saying, a lot of our caregivers are much more valuable doing what they should be doing versus filling out forms or doing some tedious transactions. A big example of that is one of our bots we created fills out our clinical denial templates so that the nurses that do those denials don't have to spend half their time just filling out demographic information and copying and pasting. And we've been able to give them fully completed forms except for that one clinical question that says, why is this being appealed? So that the nurses can focus a lot more on the work that's going to create more value for the Cleveland Clinic and for themselves too. They were really scrambling to hit productivity marks just because of how much time it takes to fill out those forms. Now that they have them all there, they're able to breathe a little bit easier. They're completing more forms than they were before. They're completing more clinical appeals than they were before, but they're also taking a breath. That's a big thing that we're really pushing for is the impact on the actual caregiver, not just on the bottom line. Another big group we're working with is our radiology team. Our radiology team is actually spinning up their own citizen developer cohort that we're helping support because within their group, they do over 2 million image reads a year. And a lot of that is opening files and pulling the image up and getting demographic information, getting test results from those things. So we're really trying to help them, again, with clinician burnout. That's another big piece that we've been focusing on. It's a big piece that all of Cleveland Clinic is focused on. So really anything we can do to help provide better for the caregivers.
Awesome. So just to wrap up, I think, hearing you say it's freeing the nurses, the doctors, the caregivers to focus on the things that create value, in a normal organization, that's great. More, better bottom line, happier customers, happier employees. And in your world, that means healthier people, a safer world, a world that, you're really impacting the lives of people. So it's wonderful to see automation have this kind of impact in an organization like yours. So it's brilliant. Thank you for sharing your stories with us today. So we're going to wrap up here. Once again, Bob, Charlie, thank you so much for joining us today, sharing your story. It's been a wonderful panel, and thanks for being with us.